Are you someone with a broad or widening hairline and you're frustrated because you don't know how to address it? We're going to discuss hairline lowering surgery. This is a wonderful procedure to address exactly what you're experiencing. We're going to talk about what this procedure is all about, its benefits, its risk, who's a great candidate, and I'm also going to discuss who should not have this surgery because it's not for everyone. For those of you who are new to our channel, welcome. My name is Dr. Ross Kopelman. I am a hair transplant surgeon. I perform a lot of hair lowering procedures as well as hair transplants, so you're going to learn a lot on this video today. If you haven't already, hit that subscribe button and let's get started. What's important for you to understand is when it comes to hairline lowering surgery or forehead reduction surgery, my goal is to help restore facial harmony. What does that mean? Our face is broken down into a golden triangle of threes. 1, 2, and 3. And we want that distance to more or less be equal throughout. The distance between the glabella and the hairline on average is between 6 to 7 centimeters. If you're someone who has a very regressed hairline, we want to try to bring that back to that distance, that 6 to 7. Sometimes a regression could be 10, 12 centimeters away from the glabella. Now on average, we remove about 2 centimeters of skin to help you get closer to that golden ratio. So this is about 2 centimeters of skin that we would remove in order to get you closer to a hairline that's much closer to your glabella and help you restore a symmetry to your face that is more balanced. The first thing that we must do to determine whether you're a good candidate for hairline lowering surgery is figure out why you're having recession of your hairline to start. At the top of my list, it's usually genetics. If your parents have a history of a regressed hairline, it's probably the reason why you have one as well. But it's also possible that you have androgenetic alopecia, which is the most common form of hair loss for both men and women. And then we have to look at traction alopecia. Are you someone that's been having really tight hair braids and hairstyles the past couple of years? That can cause recession of your hairline. Hormonal changes also play a role. Postpartum hair loss, which is after you deliver a child, or menopause could cause regression and recession of your hairline. And we then have to look at medical conditions. So if you have alopecia areata, which is an autoimmune condition where our own body attacks our hair follicles, a scarring alopecia, or even a thyroid condition, all of these can contribute to a recession of your hairline. All of these have to be considered and ruled out before we determine whether you're an ideal candidate for having a forehead reduction surgery. So not everyone's going to be a great candidate for this surgery, and that's why it's critically important to identify the root causes for why the regression is occurring. The ideal candidate has a high or broad hairline but has no active hair loss, has no scarring alopecia, and has no active autoimmune conditions on the scalp. Now, additionally, scalp mobility is going to be critically important for success because when we perform the surgery, again, we remove 2 centimeters of skin. We have to be able to move the scalp forward. If we have issues moving the scalp forward, this is not going to allow us to achieve the optimal results for scalp reduction. When it comes to surgery, we are meticulous. We spend a lot of time doing measurements because we want to make sure we're reducing the distance from the glabella to the hairline. That's first and foremost. Now, when the scalp reduction happens, we're really doing the scalp reduction between the 2 lateral areas of the eyebrows. The scalp reduction does not touch the temporal areas, so if you do need a temporal recession, this requires a hair transplant. And it's very common to do a combination of a scalp reduction surgery and later on, a couple months later, to touch up the temporal areas with a hair transplant. Absolutely normal. Now, when you do a scalp reduction, we are essentially moving 3,000 to 5,000 hair follicles in one surgery. Okay, so that's going to create a dramatic change very quickly. That's one of the reasons why people really love this procedure. Now, when we close the incision line, we do a trichophytic closure. That allows hair follicles to grow through the incision line to help camouflage a potential scar. And that is our goal. We want to have a seamless result when we perform the surgery, and so we're very meticulous about our closures. Now, there's a lot of advantages to this surgery. First and foremost, we know that the results are predictable. We know you're going to get a really nice increase in hair density, and the results are immediate. And patients love the fact that once they finish surgery, they see what the end result looks like. Now, Surgery is not without its risk, and we take every precaution to prevent any issues from happening. But I can't promise you that you're going to have no issues. So, there is a possibility for you to develop telogen effluvium, which is temporary hair shedding, in the area where we perform surgery. You could potentially also get a widening scar, infection, necrosis. And I tell all my patients, you should expect numbness for about 6 months after surgery in the central area of the scalp because we do sever the nerve and the nerve will grow back. Even though I'm very meticulous in terms of how I close the incision line, there's a possibility that you have a mild scar there. In order to camouflage that scar, we sometimes perform a hair transplant, either an FUE or an FUT approach where we put hair plugs in front and behind the incision line to camouflage that area. Additionally, hair transplants are very effective to lower the temporal areas that a hairline lowering surgery will not address. I've been fortunate to have a lot of patients who've had this surgery with me who really do appreciate the transformation that they've undergone. If you have any other questions about forehead reduction surgery that I've not addressed, please leave them in the comments below. Please hit that subscribe button if you're not already because we're trying to grow our community. And as always, I'm here on your journey to help you address your hair loss.